Welcome to Lake Forest Hospital. My name is Sanjeev Malik. I'm the Vice Chair of Clinical Operations for the Northwestern Emergency Departments and also the Chief of our Lake Forest ED. It is my privilege to welcome you to our state-of-the-art facility right here in Lake Forest. We are located in Lake Forest, Illinois, about 30 miles north of downtown Chicago. We are the flagship hospital for the North region of Northwestern medicine. We draw from a diverse community of several counties around the area, bringing patients from all over, even up into Wisconsin, into the Northwestern medicine system. While our hospital is small in size at only 114 beds, our draw is much bigger. We function as a bridge between the community hospital setting as well as the integrated academic vision that we aim to bring closer to where patients live. We function as a level 2 trauma center, as well as providing the very best in stroke care. We are a primary stroke center with accreditation, and we have a very nationally recognized telestroke program where we integrate with the very best stroke neurologists from Northwestern Memorial Hospital and bring their expertise to the patient's bedside through our emergency departments. In addition, our cardiology services are top-notch. We have a 24/7 cath lab services and part of the Bloom Cardiovascular Institute for Northwestern Medicine. Our emergency department at Lake Forest Hospital sees 34,000 patients a year, of which 20% are pediatric patients. We provide the very best care in pediatrics through our partnership with our Lurie Children's Hospital Pediatric Hospice. Lake Forest Hospital is the number 9 ranked hospital in the state of Illinois in U.S. News and World Report's ranking, which is quite a distinction for a hospital of our size. Our physicians are very proud to be the community teaching site for our Northwestern Emergency Medicine residency. We are proud to have one of the top training programs in the country, and our faculty love to teach. Our resident physicians get a very diverse patient care experience where they are seeing lots of bread and butter emergency medicine cases, but also some of the high complexity cases that typically might only be seen in a university setting.
We are one of the EMS resource hospitals in IDPH Region 10, and part of that responsibility is providing supervision for the fire departments that are within our EMS system, all of which surround the communities and are part of the communities that are served by our hospital. One of the many extraordinary things about our EMS program is the resources that Northwestern Medicine has devoted to making this a top-notch program so that we deliver excellence in education for our primary EMT and paramedic programs, our continuing education, which is performed by our EMS staff, which includes an EMS coordinator who's a retired firefighter paramedic, and 2 EMS educators, both of whom are active ED and ICU RNs. So combining that with very strong involvement from the ED, our ED physicians, I think we really bring unique strengths to Region 10 for IDPH. One of the other things that's really a strong point of our EMS program is our involvement with local community events, especially sporting events. We have a group within EMS and trauma that provides staffing, both nursing as well as physician and resident staffing for these world-class sporting events, such as PGA tournament called the BMW Championships. We do world-class and nationally recognized as well cycling events through USA Cycling and Lake Bluff, and we've done other golf tournaments in Gurnee, as well as functions at the Naval Station Great Lakes, which is one of our nearby partners.
Put simply, the emergency department here at Northwestern's Lake Forest Hospital is bread and butter community emergency medicine. The experience here really complements really well the experience the residents get downtown in Chicago, where they see a different patient population, a little bit more complicated in a different environment. Here the pace is very fast, it's very busy, and the residents see a very large volume and variety of really common emergency medicine chief complaints. As a former resident here, there are a few highlights of the rotation. Probably most importantly, the pediatrics experience here is really, really critical to our training. Residency programs across the country, emergency medicine, struggle very much to get an adequate pediatric experience for their residents. Thankfully, kids just don't get very sick that often. But here, we take care of lots of kids. I think 20% of the patient population is pediatric, so our residents really get to evaluate very common pediatric complaints in a way that's very unique. Everything from the diagnostic and the therapeutic plan all the way to calling the consultants. They do everything here. And if there's ever an issue, we have hospitalists, pediatric hospitalists that are always available to bounce ideas off of. So you're never alone, but the residents do get to evaluate them firsthand. The other things that make this rotation particularly formative and is a big highlight is the ability to function independently. So unlike downtown, where we have a very hierarchical teaching model with an attending physician and a senior resident and a junior residents and the medical student, here it's just the resident and the attending. So the resident really gets to flex their muscles and stretch their wings and see lots of patients in a way that allows them to work on becoming more independent. These community experiences really kind of give you a sense of what you're going to be like out there as an attending physician. The final highlight of the rotation here is that our residents get experience transferring patients out of the emergency department to another institution. This is a community center. It's not a tertiary medical center where everything gets funneled into. So we oftentimes have to transfer patients out to a higher level of care. And that's can be a complicated process, doing it safely, doing it efficiently, knowing how to call the other doctors on the other end, and facilitating that whole process. That's something that our residents don't really get much experience at NMH because it's a tertiary center, but here a lot of our patients get transferred. And this is a very important part of emergency medicine generally.
We're very lucky to have a diverse patient population here. We see people not only from Lake Forest, but also from the surrounding communities. And we see a number of people who get their care through Northwestern medicine who come from all over because we're the closest regional site. And so they may have some specialty care downtown as well as up in the North region, but they still come to us for their care. I trained at Northwestern and graduated in 2016, so it's very nice but very different from working downtown. So it's nice as a resident and then now as an attending to get a different perspective and a different opportunity. So up here it's a much smaller environment, so we work very closely with our nursing colleagues and our tech colleagues and our secretaries, and so everyone really knows each other on a first name basis. People know what's going on in each other's lives, and same thing with our consultants. So if you talk to a hospitalist or a consultant, everyone kind of knows each other, and it's a much more community, smaller feel than working downtown. As a former resident, I really enjoyed working up here at Lake Forest during my rotations and chose to spend extra time here and wanted to work here when I graduated. This is a great place to work. You get to provide Northwestern medicine, but with the benefits of a community-based setting. You have all of the resources of world-class medical care at your fingertips, but you also get to practice it into a more personal and family-oriented environment. So it's a great combination of both worlds. This is a great place to live. I actually grew up in this area, and it was great to come back here both to practice and to live as a resident back in this community again. It's really great being so close to downtown Chicago. There's so much to do and to see, but you also get the benefits of being in a more quiet environment too. I hope that everyone watching this video gets a chance to come here and see how great it is to be at Northwestern Medicine.